Well, we had a great talk by Dr. Edwards this morning about glioblastoma.
Glioblastoma, it's an aggressive brain cancer, and it's always a humbling and sober thing to walk into the room and you've seen the images and you know that that's most likely what it is. What would you tell patients and their families when you were thinking that glioblastoma was the most likely diagnosis and what to expect?
Yeah, those are always really hard conversations, and I think as a relatively young surgeon, I think I'm still figuring out the best way to approach that, but just being as sensitive as you can to the situation and not trying to say that you know what they're going through, present the facts, and also present yourself as someone that can be there to help. Mm-hmm. Can't change anything that's happened already, but I can help you through this. I think is a good approach. How do you like to talk to these patients?
Yeah, I like that. I like to present to them the straightforward facts about what we know, and also be sensitive to the fact that there is a lot that we don't know. I did a video that we posted on YouTube a few years ago that's maybe the most viewed video that I've personally done, and it was on glioblastoma.
Really?
And I didn't even think very much when we did the video. It was a 5-minute present the facts video. Mm-hmm. And there's dozens and dozens and dozens of comments on that video that basically says, that's exactly what happened. And then there's a few people that said, well, we beat the odds, and we're grateful for them. But we know that without treatment, glioblastoma survivability is a few months. Mm-hmm. And with treatment, if, 1 or 2 years, depending on the situation, the 5-year survival rate's definitely less than 5%. And we tend to feel pretty good if a patient survived 2 or 3 years. Mm-hmm. Is that kind of what your experience has been?
Yeah, same kind of experience. I think we're just trying to help them buy some special time with their family and loved ones through treatment, and just really trying to make the process as smooth as it can be in a really, really difficult situation.
On a positive note, I saw a patient in clinic last week who had her glioblastoma, which was a big tumor. It wasn't the one I presented this morning, but it was just as big, also right temporal lobe. And she was really struggling with just her being awake and alert and knowing what's going on. Mm-hmm. And she had surgery, and she's getting chemo and radiation therapy, and you'd look at her and not even know that she had a tumor. Really? That she had anything going on. She looks fairly normal. So I think we want to get a maximal safe resection when we want to initiate chemo and radiation therapy. And to your point, we want to give the patients meaningful quality time. And that's really our purpose. Now, how much time, that depends on a variety of factors. But that is what we're trying to do for them. And then just, be there for them and help them through it, 'cause they have a lot of questions and everything. So
it always amazes me how different patients really have a different response to bad news like that. And as providers, we go in, and these aren't easy conversations. We go in and just really try to find the best words to present the information. But the way that patients respond really surprises me. Sometimes it's just, I kind of knew something wasn't right, and they're very accepting. And other times it's a little bit more of a surprise, but there's definitely a spectrum of reactions and emotion.
Man, I remember in the emergency room a few years ago, a man in his 60s, I walked in, he knew what it was, I knew what it was, and as soon as I described what I saw in the image, he looked right at his wife and he said, "I'm sorry." almost like it was something he had done, but he knew that his time to be with his family was now limited. And then we have patients that take the approach of, I'm going to beat this, and they do all the things they can do, and there's tons of recommendations out there from different people, and I think that that's great. We don't want to diminish any hope or optimism, and sometimes that is a way to cope as well. And then others that grieve in other ways or respond in different ways, and so we see the same problem, and every single situation has its very unique story behind it.
No matter what the patient decides that they want to do as far as different supplements, or I feel like if I were a patient, I would want to try to feel like I did everything I could to beat this, and we can't blame patients for doing the same thing. And even though it may not be a standard protocol or something like that, like you said, I feel like we really just try to support them as best as we can, even if there may not be a lot of data, as long as it's something relatively safe. I think that's a good way we can kind of support them in their path. In
all of medicine, and especially with glioblastoma, there is data that we have what to expect from our perspective, given all the historical population studies. There's standard protocols to follow, but every case is different, and everybody has a different objective and goal. And I think first and foremost, we want to be there to support the patients in doing everything we can to help them achieve what they are trying to achieve.
Yeah, 100%.
And whether it's glioblastoma or a disc herniation, it's all the same. And so when patients listen to this, and that's the perspective that we have. We don't know everything. We know some things, and we have some ability to help. And we want to just be there the best we can to be a part of their care and help them through it.
Yeah, I agree.